next is we're going to inspect and palpate the nose. So first, press along the nose bridge. So you need to press along the bridge of the nose, feeling the bony skeleton in the skin thickness. Next, press on the tip of the nose with one index finger to elicit tenderness. So no signs of tenderness, no problems of breathing, or no presence of any discharges. Next, we're going to palpate the sinuses for tenderness in the frontal, ethmoid, and sphenoid, and maxillary. So the ethmoid sinuses are between the eyes and behind the nasal bridge. Palpate the area around the middle canthus to assess ethmoids, while the sphenoid sinuses are deep to the ethmoids and it is behind the eyes. That's why cannot be palpated. So next, to palpate the frontal sinuses, place the dump under the brows of the patient's eye. So which is here. Wait. So next, to palpate the maxillary sinuses, gently press your thumb on each side of the nose, just between the cheekbones. Okay, so frontal and maxillary sinuses are non-tender to palpation and no any masses found. So lastly, we're going to proceed in the mouth and throat. So next, I will inspect to your outer and inner surface of your lips to check the color, moisture, pigmentation, masses, or any ulceration present. So ma'am, can you purse your lips? Can you purse your lips now? I will just palpate your lips to check the texture and to see any lesions present. So ma'am, can you open your mouth for me? I will just check your teeth so to see if it is the general condition, if it's okay. As I am checking your mouth, with the use of tongue depressor and pen light, I don't see any discoloration or any bleeding, no gingivitis, the buccal mucosa, and as I was counting your teeth, I see that you have missing molar, and in general it is good. I also see that the color of the roof of your mouth is reddish in structure and it is normal. Okay. Using a pen light, I will inspect the surfaces of your tongue. Can you place the tip of your tongue on the roof of your mouth? Okay. So, can you move your tongue upward and downward? Okay. So, I'll just check your tongue movement. Can you show it again? Okay. Again, using a tongue depressor, I will inspect the buccal fold. And lastly, using a tongue depressor, I will inspect the buccal fold under the tongue. I see that no ulcer, white patches, or lesions present. The color of your buccal mucosa are red. It is moist and no lesions seen. Okay. Next, I will inspect your oropharynx using a tongue depressor again. Can you open your mouth, please? I don't see any tonsillar enlargement, redness, or discharge. So I can say that everything is normal and perfectly fine. So your tonsils are hidden within tonsil pillars and it is normal. And lastly, this may will feel a bit uncomfortable. I will just conduct a gag reflex using a tongue depressor to provide a support to your tongue. Okay. Ma'am, can you drink water? Okay. So that's it, ma'am. We're done in assessing your eyes, your ears, your nose and sinuses, your mouth, and your throat. So everything is normal and perfectly fine. No signs of any lesions, tenderness, or swelling, or any masses in your ears and also in your eye. And there are no dryness or signs of ulceration in your mouth and throat. The nose is in normal nose, no signs of any discharge. Yes, that's it, ma'am. So thank you. That's it. Thank you, Ma'am Jazz.
Thank you po.
Okay. And lastly, perform a hand hygiene. And that's it.